Hey, Dr. Matt here today. Today what I'm going to talk about is neuropathy. I want you to be able to understand what neuropathy is. I want you to understand the differences between the two types of neuropathy that are out there, where they both originate from and come from, and then how to kind of differentiate between the two. So let's talk about that. So neuropathy is damage to the nerve. So when the nerves begin to become damaged and give improper signals back to the brain, or pain signals back to the brain, that's what neuropathy is. Now there's two types of neuropathy. There's neuropathy that is centrally mediated, okay? Centrally mediated neuropathy is going to come from the spine itself. So your brain is sending messages down the spinal cord, out the nerves on either side of your spine, to every single organ, tissue, cell in your body every single second of the day. So for you to hear me, your heart to beat, your lungs to breathe, your brain's getting messages out to all the organs all the time. Okay, so your central processing unit up here in your brain getting the messages out. Now, a centrally mediated neuropathy is going to come from damage centrally within the body, or that spinal cord or spinal column. This could be a result of a herniated disc, stenosis, a bulging disc, osteoarthritis of the bones, anything happening with the spinal column itself is going to be more centrally mediated, or also known as a radiculopathy. Centrally mediated neuropathies are going to typically be down one side, okay? They're going to be one-sided, down one arm or one leg, not down both arms or both legs. We're also going to see with radiculopathy that it can be trauma related. Doesn't have to be, but it also can be wear and tear of the spine itself, meaning inflammation around the disc, inflammation around the nerve, muscle tightness around the piriformis muscle. Okay, those are centrally mediated. Now, peripheral neuropathy means that it's coming from the outside of the body, okay, or the extremities, the hands and the feet, and you're feeling those pain signals come up to the brain, and that's where they're being sent. So the damage is actually happening down here at the feet or out here in the hands, and it migrates toward the body. With peripheral neuropathy, there's two components of your body that are being affected. One is the blood vessels. Two is the nerves. More times than not, the blood vessels are going to be the first one that are going to be affected. The blood vessels feed nutrients to those nerves as well as take away waste. This causes a degeneration within the nervous system in the periphery of the body. We see this commonly with people with diabetes. In fact, about 30% of the cases of diabetes are going to develop peripheral neuropathy. We see people with vascular issues develop peripheral neuropathy. We see people that have toxicities. About 30% of the people that have received chemotherapy will develop peripheral neuropathy. And typically peripheral neuropathy is going to be bilateral, meaning both hands or both feet, where centrally mediated neuropathy is going to be more one-sided. We'll also see people with peripheral neuropathy develop it as a result of medications they've taken throughout their life. Statin drugs are a huge one that develops peripheral neuropathy. Nutrition, surgeries, traumas, kidney, liver, thyroid disease can also develop peripheral neuropathy. So infections, autoimmune diseases also can cause damage and create peripheral neuropathy. Now, all of those things, okay, all of those causes primarily are first going to do damage to the blood vessels, okay? This is why it's a slow progressing disease that later on, once a damage has been in there, the nervous system becomes affected, which is creating the pain and the pain signals. So we have two different types of neuropathy. We have centrally mediated and we have peripheral mediated. Now it's very important to be able to distinguish between the two types of neuropathy. If you just give a painkiller for either of these, it's not addressing the root cause of the problem. In fact, we see a lot of people with peripheral neuropathy come in that are just really frustrated because what they've been doing is they've been taking drugs like gabapentin or Neurontin or Lyrica for years, and what those drugs do is they actually work on the brain and they slow down the function of the brain. But the problem is actually happening down here in the feet or out in the hands. So while you're taking the medication and the pain is going down, it's just blocking it up here in the brain while the damage in the hands and feet continue, which is very frustrating for many neuropathic patients because the root issues are never truly being addressed. People with radiculopathy or centrally mediated neuropathy, they're frustrated with the fact because many times when they get this pain, they're led to going to cortisone injections or medications as well versus helping to correct those things. So at our office here at LifeWorks, we actually help to differentiate between the two. If it's a centrally mediated neuropathy, what we work with is correcting the imbalances in the muscles. We work on correcting the alignment first, and then if it's not progressing properly, then we can get more aggressive if we need to and get you to other professionals. And maybe at that time it's so bad that you absolutely need surgery. We get that, right? But let's make that the last option if possible. And then peripheral neuropathy, we work on regenerating the nerves and the blood vessels on the underside, and we'll talk more about that in another video on what our treatment for peripheral neuropathy looks like and why we do that, because we address both the blood vessel growth as well as regenerating the nervous system. So if you have any questions, put the comments below. We're going to try to get to those as quickly as possible. If you like this, be sure to put a little thumbs up or like sign on it and send it to somebody that you know that may be suffering with this, because this is quickly becoming the leading cause or a leading disability here in the United States. It's affecting millions of people. So hopefully this helped, and we'll see you on the next video.